Assalamualaikum everyone, welcome back to this channel. This is me Arya Wahid. In this video we are going to start the drugs for the diabetes. So let's discuss there some overview, and after that we will discuss the diabetes. So why the diabetes is occurring to you? So it is occurring due to decrease in the production of insulin. So let's discuss how the insulin is going to produce. Actually, an organ is present inside your body called as pancreas. So in the pancreas, islets of Hanger lens contain three types of cells: beta cells, alpha cells, and gamma cells. Beta cells is producing insulin, alpha cell is producing glucagon, and gamma cells is producing somatostatin. So actually this insulin is decreased and the diabetes happens to you. So let's discuss the importance of hormones and importance of insulin. So it play important role in the metabolic activity or glucose homeostasis. Homeostasis means the balance. So it is maintaining the balance of glucose inside your body, not increase the concentration of glucose and not decrease the concentration of glucose. Maintain the glucose concentration in a normal or balanced way. So let's discuss pathology related to insulin. So two cases are discussed: hyperglycemia and hypoglycemia. Hyper mean high concentration of, glycemia mean glucose, means glucose is high. Whenever the glucose increase, insulin concentration is decrease. And whenever there is hypoglycemia, hypo mean low and glycemia mean glucose, it's mean insulin concentration is high. So if glucose is decreased, insulin is high. If glucose is high, insulin is low. So it's mean there is indirect relation between the glucose and the insulin. Let's discuss the first pathology case, which is the hyperglycemia. Hyperglycemia mean increase in the concentration of glucose, mean high glucose levels and low insulin levels. Maintain these two conditions whenever I discuss hyperglycemia to you. So hyperglycemia you face a disease which is called a diabetes mellitus. What is this disease? It is a metabolic disorder characterized by increase in the glucose levels due to decrease in insulin level. इंसुलिन लेवल कम होगा, ग्लूकोज लेवल बढ़ जाएगा, जिसकी वजह से डायबिटीज होगा. What are the symptoms? Symptoms are thirst increase होगी, which is called as polydipsia. Dyspia. Pia mean pani, and thirst is increase in urine, which is called as polyuria. Poly means many and urea mean urine, mean high level of urine. Weight loss means you are facing the weight loss, because and you also face increase in the appetite. So this case is called as polyphagia, increase in the appetite. And you will fatigue. So now you will ask the question that weight loss is happening when the glucose level is high. Whenever the glucose level increase, the body weight should also be increased. But the answer to this question is that uh, whether the glucose level is high, but due to very low levels of insulin, your body cells cannot consume glucose. Okay, your body cells need insulin to to move the insulin inside the cell and to make the energy from that glucose. So therefore now you due to decrease in the level of insulin, your body cannot consume the high levels of glucose. So glucose will begin to accumulate and increase in the body but cannot be used. So therefore weight loss and fatigue happen, because now you are not using your glucose, you cannot make energy from it, so therefore you will feel fatigue. There are three types of diabetes: type 1, type 2 diabetes, and gestational diabetes. In the previous classes you have only discussed the two types of diabetes, type 1 and type 2 only. Now we will also discuss the type 3 in this lecture. So type 1 diabetes is occurring in about 5 to 10% only. So it is rarely occurring and it is very less common. But if you see about the diabetes 2, type 2, it is occurring in 90 to 95% of the population. So it is very important and it is occurring in almost the 90% of population. So let's discuss all of these types of diabetes one by one, and in the next lecture we will discuss their treatments. So this is the type 1 diabetes. Actually, type 1 diabetes is the autoimmune disorder. Autoimmune means the body own cells are going to destroy our own body. So what is the cause of it? Actually, our immune system will go and destroy the beta cells of the pancreas, and now whenever the beta cells are destroyed, no insulin can be produced. So this is the cause behind it. Onset, it occurs in child and also occur in the adults. Risk factor, there are two risk factors: genetic disposition and environmental triggers. What is mean by genetic disposition? It means the family history. So if you have a family member in your siblings, in your parents, if they have a diabetes, then there is a chances that the child can have a diabetes in his life. So therefore a family history really matters, because the genes can also transmit it and they cause diabetes, whether in the childhood or whether in the adulthood. So there are some environmental triggers like poor diet, physical inactivity, having no exercise, no healthy life, and obesity. They are the really main factors which are causing you diabetes. Treatment, this patient will leave lifetime insulin therapy in his life. Let's discuss the type 2 diabetes. So type 2 diabetes is not autoimmune disorder. So let's discuss about it. So in the type 2 diabetes, a cell does not respond to the insulin. Your pancreas, your beta cells will produce insulin, but now the cells which should respond to the insulin, they are not responding it. So on onset is of this disease is in the adults and also occur in the young individuals who don't maintain their life cycles in a well mannered. Or next, the risk factor for it like obesity, the people who have very age, and the family history also matters in the type 2 diabetes, which is occurring in 90 to 95% of the people. Let's discuss its treatment. So its treatments include various kind of injections and oral therapies. And all of these oral therapy, what are their function? Actually, all of these therapies will focus to decrease your glucose level, to decrease the glucagon level. Glucagon is produced by the alpha 1 cells of pancreas, and to increase the levels of insulin. So let's discuss the third and the last type of diabetes. So the gestational diabetes, this is the diabetes which is occurring due to high levels of sugars during the 6th and 7th month of pregnancy. So in the pregnancy, due to what are the causes of increase in the glucose level during the 6th and 7th month of pregnancies? So there are the causes written like the hormonal changes. In the case of pregnancy, there are a lot of hormones are changing. Due to the age, it can happen. Due to obesity, it can happen. And treatment is again the insulin therapy will given to the particular patient according to his condition and according to his need. So this was all about the today's lecture. We have discussed the types of diabetes. In the next lecture we will focus on its treatment through the insulin therapy. We will discuss what kind of drugs will needed to that patient, and we will discuss the whole things in the next lecture. I hope that you will like this video. If you like it, then please subscribe to my channel, like my videos, and also press the bell icon to get the notification of all the videos which I uploaded. Thank you so much. Meet you soon in the next lecture. Till up, Allah Hafiz.